This is All India Radio. Good afternoon. I am Lalema Aneja Dang, and with me is Prashant Kumar Sinha with the Midday News. The headlines. Prime Minister Narendra Modi interacts with the chief ministers to decide the future course of action in the fight against COVID-19. Marine industry and its workers exempted from lockdown restrictions by government. Bihar government steps up vigil in hotspot areas of 3 districts to contain coronavirus. ICMR gives approval to convalescent plasma therapy for COVID-19 treatment. COVID-19 positive cases decrease in Kerala. Over 1 crore people download Arogya Setu mobile app. Government says the app is safe and does not infringe upon privacy. WHO warns against premature lifting of restrictions imposed to control COVID-19 pandemic. And in Jammu and Kashmir, Indian troops retaliate to the unprovoked firing by Pakistan Army along the LOC in Poonch district. Prime Minister Narendra Modi is holding a meeting with chief ministers of all the states via video conferencing to decide the future course of action in the fight against COVID-19. Mr. Modi is expected to take their feedback on whether the 21-day nationwide lockdown be extended beyond April 14 to stem the tide of the infections. Ahead of the meeting, Principal Secretary to the Prime Minister took stock of the situation with the empowered groups at a high-level meeting in New Delhi yesterday. The meeting is significant in the wake of appeal to extend the complete lockdown beyond 14th April. A 21-day complete lockdown of the entire nation was announced on the 24th of March. Punjab and Odisha have already announced extending the lockdown beyond April 14 when the 21-day shutdown across the country ends on Tuesday. Prime Minister has already held talks with leaders of various political parties on the 8th of this month, as well as with different stakeholders to seek their views and support to contain the spread of COVID-19. The Prime Minister has discussed on 2 occasions the implementation of lockdown with state chief ministers and LGs of union territories. He held interactions with them via video conferencing on the 20th of March and the 2nd of April. A total of 1,035 new confirmed cases of novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 7,447. Health and Family Welfare Ministry said that 643 patients have been cured so far. During the last 24 hours, 40 deaths have been reported, taking the nationwide toll to 239. Indian Council of Medical Research ICMR has said that a total of 1,61,330 samples have been tested so far, including 15,663 samples which were tested yesterday. ICMR has scaled up its testing facilities by giving approval to 146 government laboratories and 3 collection centres. In addition, 67 private laboratories chains have also been given approval to conduct the test for COVID-19. The centre has exempted the operations of the fishing or marine aquaculture industry from the purview of the ongoing nationwide lockdown. In a communication to the Chief Secretaries of all states and union territories, the Union Home Ministry said the decision has been taken by Union Home Secretary Ajay Bhalla in his capacity as chairperson of the National Executive Committee constituted under the Disaster Management Act. However, the Home Ministry said, as specified in the lockdown measures, social distancing and proper hygiene practices must be ensured, and it will be the responsibility of the head of the organisation or the establishment to ensure compliance of such norms. In view of the ensuing festivals in the month of April, Home Ministry has directed all states and union territories to ensure strict compliance of lockdown measures to fight COVID-19 and not allow social, religious gatherings and processions. The ministry said it has been communicated to them to take all required precautionary preventive measures for maintenance of law and order and peace and public tranquility. Appropriate vigil on social media should also be maintained against circulation of any objectionable and fake content. The Home Ministry has further requested that for the attention of the public authorities, social and religious organizations and citizens, the respective provisions of the guidelines should be widely circulated. It adds that for violation of any lockdown measure, action against the relevant penal provisions of the Disaster Management Act and IPC should be taken by the law enforcing agencies.
Researchers at the National Institute of Pharmaceutical Education and Research, Guwahati, have come out with 2 products that promise to be of great help in the fight against COVID-19. The first product is a 3D printed hands-free object that could be used to help open or close doors, windows, drawers, refrigerator handles, among others. Doors, windows, switch buttons, elevator buttons, drawer handles, refrigerator handles are some of the most germ-infected objects in houses, hospitals, factories and other buildings. The second product is a 3D printed antimicrobial face shield to control the spread of COVID-19. It was designed after a thorough study to understand how viruses spread through oral, ophthalmic, nasal and other body cavities. The Sri Chitra Tirunal Institute for Medical Sciences and Technology, Kerala, has obtained a go-ahead for taking a bold step to provide innovative treatment to patients suffering from COVID-19 disease. The Trivandrum-based SCTI-MST is an institution of national importance under the Department of Science and Technology, Government of India. Technically called convalescent plasma therapy, the treatment aims at using the immune power gained by a recovered person to treat a sick person. The ICMR has given approval to the SCTI-MST for carrying out the novel treatment. The therapy, like blood transfusion, harvests the antibody from a recovered patient and ingests it into a sick person. Helped by the antibody, the immune system mounts robust combat on the virus. Health Minister Dr. Harshvardhan has urged states to promote mobile app Arogya Setu to bring the people of the country together in a resolute fight against COVID-19. Sharing a video conference with states regarding the steps taken on COVID-19, Dr. Harshvardhan said the fight against the pandemic is now more than 3 months old and the prevention, containment and management is being monitored at the highest level in collaboration with the states. Pointing to the critical importance of the next few weeks to break the chain of transmission of the disease, the minister urged all to ensure social distancing and to spread awareness about personal hygiene.
The Arogya Setu mobile app has crossed over 1 crore downloads. People are finding the app very effective as the app is very safe and there are no privacy concerns. The rumors about data surveillance in this regard are fake and unfounded. Countries like Singapore, the US, the UK, South Korea, Apple and Google already have such systems in place for public safety. Principal Scientific Advisor to Government of India, Dr. K. Vijay Raghavan has said that Arogya Setu mobile app is an important weapon in the fight against COVID-19. Talking exclusively to AIR News, Dr. Vijay Raghavan said Arogya Setu mobile app is critical because if someone is tested positive, people who came in contact with them can be identified.
Arogya Setu app is very, very valuable because it combines contact tracing with a link towards testing. Remember that COVID-19 is a disease which is transmitted not only by those who show symptoms and who are positive, but by asymptomatic people also who are positive for the illness. Therefore, Arogya Setu is critical because once someone tests positive, their recent past, people who are in the recent past close to them, are identified and told to be isolated or tested or do whatever is necessary, in addition to those who are immediately in contact with them. So Arogya Setu hits as an offensive weapon into the heart of the disease.
The Employees Provident Fund Organization, EPFO, has settled 1.37 lakh Provident Fund withdrawal claims worth 280 crore rupees to provide relief to subscribers during the lockdown. The amount was disbursed under a new provision especially formulated by amending the EPF scheme to help subscribers to fight COVID-19. Our correspondent reports that the EPFO has settled these claims in the past 10 days.
The provision for a special withdrawal from the EPF scheme to fight COVID-19 pandemic is part of the PM Garib Kalyan Yojana scheme announced by the government last month. Under the new provisions, the retirement fund body is processing all applications which are fully KYC compliant within less than 72 hours. Members who have applied for claims in some other category can also file for claim to fight the pandemic, and depending upon the KYC compliance condition of each member, every effort is being made to settle claims at the earliest. Under this provision, non-refundable withdrawal to the extent of the basic wages and dearness allowances for 3 months or up to 75% of the amount standing to members' credit in the EPF account, whichever is less, is provided. The member can apply for lesser amount also. As it is an advance, it does not attract income tax deduction. Claims for availing advance are filed online, necessitating every EPF account to be KYC compliant as precursor. Besides, the EPFO has relaxed date of birth correction criteria to ease KYC compliance, enabling submission of claim. It will accept the date of birth recorded in the Aadhaar card of a subscriber as a valid proof for rectification of the date of birth in PF records. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
Food and Consumer Affairs Minister Mr. Ramvilas Paswan announced a life insurance cover of up to 35 lakh per person to over 1 lakh rupees to the Food Corporation of India FCI officials and labourers in case they succumb to the coronavirus after 6 months of performing duty from the day of lockdown on the 24th of March. State-owned FCI is the centre's nodal agency that is engaged in the procurement of food grains at a minimum support price MSP directly from farmers and distributes the same at a subsidized rate to over 81 crore ration card holders in the country.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Rakesh Garg of AIIMS said spread of COVID-19 can be contained if people follow the guidelines and take necessary precautions.
The social isolation continues in a very nice way, then probably we'll be able to have containment. So there may be some clusters which are upcoming, but with good contact tracing and with good quarantine of those who have suspects or those who have contact with these positive patients, if they can do a good amount of quarantine at respective places, then probably we think that the containment of the virus may be a good option, and we hope that it would happen.
Dr. Sanjay Pandey of GB Pant Hospital said there is no proof in the claims that taking vitamin C will either cure or prevent COVID-19.
विटामिन सी को लेकर इस तरह के दावे किए जा रहे हैं, लेकिन इसमें कोई सच्चाई नहीं है कि विटामिन सी से कोरोना वायरस के ऊपर कोई हम या तो कंट्रोल कर सकते हैं या व्यक्तिगत रूप से किसी को विटामिन सी लेने से उसको कुछ फायदा हो सकता है। हाँ, आप ले सकते हैं विटामिन सी, कोई भी विटामिन ले, खाने पीने में आप जो भी लेना चाहें ले सकते हैं, लेकिन साइंटिफिक एविडेंस विटामिन सी के बारे में भी नहीं है।
And for listening to our other experts, tune in to our next bulletin. Health and Family Welfare Ministry has issued an advisory to stop the social stigma associated with the COVID-19. This advisory came in the wake of reported cases wherein corona patients, frontline workers like doctors and nurses, certain communities and areas faced discrimination due to fear and misinformation about coronavirus. Here's more from our correspondent.
Health Ministry has urged on the need to counter such prejudices and advised that through social distancing and personal hygiene, this disease can be eliminated. It has been advised to the people to follow certain steps to end the social stigma associated with novel coronavirus. Healthcare professionals and sanitary workers who are providing their services in this difficult situation deserve people's support and appreciation. Do not target healthcare professionals, sanitary workers and police. Names or identity of affected person and their locality shouldn't be shared on social media. Do not label any community or area for spread of coronavirus. Avoid spreading fear and panic. With Diwakar, Bhupendra Singh, AIR News, Delhi.
Principal Scientific Advisor to the Government of India, Dr. K. Vijayaraghavan, has said that wearing masks is better than not wearing any masks to protect oneself from COVID-19. Talking exclusively to AIR News, Dr. Vijayaraghavan said on the importance of covering the mouth and nose in public. He said people must not use masks in a way that causes a short supply for frontline health workers, but instead opt for homemade, reusable face covers that are thoroughly cleaned. Dr. Raghavan said the Setu mobile app is an important weapon in the fight against the COVID-19. He said the app is a very valuable thing because it combines contact tracing with the link towards testing.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi interacts with the chief ministers to decide the future course of action in the fight against COVID-19. Marine industry and its workers exempted from lockdown restrictions by government. Bihar government steps up vigil in hotspot areas of 3 districts to contain coronavirus. ICMR gives approval to convalescent plasma therapy for COVID-19 treatment. Number of positive cases decline in Kerala. Over 1 crore people download Arogya Setu mobile app. Government says the app is safe and does not infringe upon privacy. WHO warns against premature lifting of restrictions to control COVID-19 pandemic. And in Jammu and Kashmir, Indian troops retaliate to the unprovoked firing by Pakistan Army across the LOC in Poonch district. Well, for quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
People across the country are following the government's appeal to stay in their homes during the lockdown period. To deal with the present situation, people are engaging themselves in different activities like completing their household chores, playing indoor games, reading books, doing gardening and pursuing their hobbies. We spoke to a cross-section of people who share their views on lockdown and how they are utilizing their time during this period.
I, Sirin Prakash from Patna, Bihar. This year I appeared in class 12th board exam. I would like to appreciate the decision of lockdown by our Prime Minister Shri Narendra Modi ji. I am spending quality time with my family. I am learning basic cooking from my mother and also taking interest in household activities which will be helpful in my future. In today's busy life, we are not getting this much of time to learn all these activities. I request to all the citizens of my country to stay at home and stay safe.
This is Ritika from Lilua, Havra. I think this is the time when we all should maintain social distancing by staying at home. Owing responsibilities towards society during community assistance amidst crisis of COVID-19, I have distributed food and sanitation items nearby my society. We, the citizen of India, must follow all the guidelines issued by the government time to time.
People who are stepping out of their homes for providing essential services are taking all necessary precautions.
My name is Urvashi Sehgal, a banker by profession, posted in Kanpur region. Recently married. My husband is also a banker who is posted in Chitrakoot. In this time of pandemic, we are serving the nation by performing our official duties, by serving our profession. Kindly stay home and stay safe because we are out for you.
Kerala is almost flattening its curve of COVID-19 infection, with few positive cases being reported and more people getting recovered in the last few days. Here's a report.
Kerala reported the first case of COVID-19 in the country on January 30th after 3 persons who returned from Wuhan tested positive. After 102 days, Kerala to a greater extent had managed to contain the spread of the disease, which is creating a catastrophic situation across the globe. A total of 364 COVID-19 cases were confirmed in Kerala till today. Presently, 238 patients are under treatment. 124 people had recovered from infection so far and 2 succumbed to the disease. The number of people under observation had also decreased to 1,29,000 in the state. Through aggressive testing, contact tracing, effective communication, strict surveillance, use of technology, larger intervention from government, local bodies, self-help groups and public at large had helped Kerala to take hold of the situation. Meanwhile, Chief Minister Pinarayi Vijayan said that the caution and the alert will not be eased at any level. Instead, the efforts will be strengthened more as the spread of the virus cannot be ruled out yet. The state is aggressively preparing adequate treatment facility, exclusive COVID health centers, PPE kits, ventilators, isolation beds are being arranged in all possible areas, even in houseboats of Alappuzha. The lockdown guidelines are further strengthened in the worst-hit Kasaragod district. Mayusha, 4AR News from Thiruvananthapuram.
The Bihar government has instructed to step up vigil in hotspot areas of Siwan, Begusarai and Nawada districts to contain coronavirus. Chief Minister Nitish Kumar has asked health officials to ensure comprehensive screening of maximum people in those areas where positive cases of COVID-19 were detected in large numbers. AIR correspondent reports that additional security forces have been deployed in affected areas to enforce lockdown effectively. Health checkup of those people are being done who are living in 50-meter radius of hotspot areas of Siwan, Begusarai and Nawada districts. Over 200 people have been kept in quarantine in those areas where 23 people of a family were detected positive. NDRF Jawans have been pressed into service for sanitization. The administration has stopped movement of boats in River Ganga. In Madhya Pradesh, the corona outbreak has spread to 20 districts of the state, while number of corona-infected patients has also increased to 453, of which 36 have died so far. Indore has the highest number of 229 patients. There are 124 infected patients in Bhopal, 14 each in Khargone and Barwani, 13 in Vidisha and 12 each in Ujjain and Morena. On the other hand, the BJP MLAs of the state will also take less salary on the lines of MPs. They will also be able to use their legislative funds to fight against corona infection.
BJP MLAs in Madhya Pradesh have decided to take 30% less salary for 1 year. Chief Minister Shivraj Singh Chauhan has also appealed to the MLAs of other parties to take less salary.
भारतीय जनता पार्टी के विधायकों ने मुझसे ये कहा है कि हमारी 30%, 30% सैलरी आप काटिए साल भर, कोई दिक्कत नहीं है। बाकी विधायकों से भी मैं अपील करता हूं कि जैसे सांसदों ने 30% सैलरी कम लेने का फैसला किया, वैसे मध्य प्रदेश के विधायक भी करें। ये संकट का समय, जितना पैसा आवश्यक है हम बचा के इस युद्ध में लगाएं। आज हम विधायक निधि के नियमों में भी संशोधन करने वाले हैं।
The MP government is also amending the legislative fund provisions. As a result, MLAs will now be able to use their 1-year fund to fight against corona. The Chief Minister also spoke to former Chief Ministers of the state, Kamal Nath, Uma Bharti and Digvijay Singh, and sought suggestions and cooperations to fight against corona. Sanjeev Sharma, AIR News, Bhopal.
A total of 183 new confirmed cases of novel coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 903. The Delhi government has confirmed that 27 patients have been cured and discharged, and 14 deaths have been reported in the national capital. Cases related to the Markaz has a contribution of around 65% out of the total confirmed cases in Delhi. A total of 584 confirmed cases have been reported from Markaz. The Delhi government has conducted 11,061 tests so far.
Puducherry Union Territory reported its first death due to COVID-19 in the Mahe region today. 71-year-old man Mehroop died at the Pariyaram Medical College Hospital, Kannur, Kerala today.
Mehroop was taking treatment for kidney ailment in a private hospital at Kannur since April 1st, where he was tested positive for COVID-19. Following this, he was shifted to the Pariyaram Medical College Hospital, where he died today. Mehroop is from Chalakkara in Mahe, and all his relatives and others who had contact with him were isolated earlier and tested negative for the virus. Earlier, a 68-year-old woman from Mahe recovered from the disease and discharged. Presently, 7 positive cases are admitted at the Indira Gandhi Government Medical College, Puducherry. Chandramohan, AIR News, Puducherry.
In Gujarat, the total number of confirmed cases for COVID-19 reached 432, with 54 new cases reported in the last 12 hours. State Health Department said 31 new cases were reported in Ahmedabad, 28 from Vadodara, 3 from Anand and 1 each from Bhavnagar and Surat. Principal Secretary of Health Department Jayanti Ravi said 376 COVID-19 patients are stable, while 3 are on the ventilator. 1 patient was discharged from Gandhinagar today. So far, 34 patients have been discharged after complete recovery.
Former Chairman J&K Legislative Council and senior BJP leader Ladakh Haji Anayat Ali urged the Ladakh Union Territory Governor Mr. R.K. Mathur to make necessary arrangements for bringing back thousands of stranded residents in Srinagar, Jammu, Delhi and various parts of the country. He stressed the fact that most of those stranded are either elderly who are not used to the humid conditions of the plains or students. He also said that most residents are staying in rented accommodations, especially students, and cannot prolong their stay. He also urged the government to formulate a time-bound strategy to evacuate the stranded residents before the holy month of Ramadan.
Ayush Ministry has approved the telemedicine guidelines for homeopathic practitioners. Announcing this, Minister of State for Ayush Ministry, Shripad Yaso Naik, emphasized on the need to mobilize the Ayush workforce to align with the COVID task force. Mr. Naik announced this in an international webinar which was organized by the Central Council for Research in Homeopathy, CCRH, under the Ayush Ministry on World Homeopathy Day yesterday. Thousands of participants attended the webinar. Most of the speakers spoke about potential of homeopathy which can be harnessed in the containment of COVID-19 and presented facts about the use of adjuvant homeopathy along with standard care for COVID patients. World Health Organization has warned any premature lifting of restrictions imposed to control the COVID-19 pandemic could lead to a fatal resurgence of the new coronavirus.
Some countries are already planning the transition out of stay-at-home restrictions. WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence.
WHO Chief Dr. Tedros Adhanom Ghebreyesus said in a virtual press conference in Geneva that WHO is working with affected countries on strategies for gradually and safely easing restrictions. The global death toll has gone over 1 lakh. More than 1.6 million infections have been recorded globally since the virus first emerged in China in December 2019.
In Pakistan, the total number of cases today rose to 4,788 with more than 190 fresh infections. The death toll from COVID-19 has reached 71. Meanwhile, China is providing more medical supplies to Pakistan to fight the coronavirus pandemic. Authorities in Pakistan have so far conducted 57,836 tests, including 2,457 in the last one day. The official data showed that 52% patients were those who had travelled abroad, while 48% were local transmissions.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. A.K. Varshni, Professor and Consultant in Medicine at Atal Bihari Vajpayee Institute of Medical Sciences, and Dr. Ram Manohar Lohia Hospital, New Delhi, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. You may also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You may also follow us on the News on AIR app for updates. The global coronavirus death toll crossed 1 lakh yesterday as Easter celebrations around the world began in near-empty churches with billions of people stuck indoors to halt the pandemic's worldwide march. The grim milestone came as the World Health Organization issued a dire warning that prematurely lifting lockdown restrictions, which have kept more than half the world's population in lockdown, could spark a deadly resurgence of the disease. The extraordinary measures from New York to New Delhi to Naples have seen businesses and schools closed in a desperate bid to halt the virus's relentless spread, and the International Monetary Fund said the world now faces the worst downturn since the Great Depression of the 1930s. In yet another ceasefire violation, Pak Army initiated unprovoked firing with small arms and intense shelling with mortars along the LOC in Kirni sector of District Poonch today. PRO Defence said that at about 9:50 hours today, Pak Army initiated unprovoked ceasefire violation by firing with small arms and intense shelling with mortars. The exchange of fire was continuing when reports last came in. The Indian troops guarding the fence are retaliating with equal caliber. Vice President Venkaiah Naidu today paid homage to Jyotiba Phule on the occasion of Phule's Jayanti. In a tweet, Mr. Naidu said, Jyotiba Phule will always be remembered for his crusade against the caste system, uplifting the downtrodden and pioneering women's education in India. Vice President Venkaiah Naidu has wished the nation on the eve of Easter. In a message, the Vice President said that the story of resurrection is a reminder that light will always triumph over darkness. He wished that India and the world will emerge victorious in the fight against COVID-19. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi interacts with the chief ministers to decide the future course of action in the fight against COVID-19. Marine industry and its workers exempted from lockdown restrictions by government. Bihar government steps up vigil in hotspot areas of 3 districts to contain coronavirus. ICMR gives approval to convalescent plasma therapy for COVID-19 treatment. Number of positive cases decline in Kerala. Over 1 crore people download Arogya Setu mobile app. Government says the app is safe and does not infringe upon privacy. WHO warns against premature lifting of restrictions to control COVID-19 pandemic. And in Jammu and Kashmir, Indian troops retaliate to the unprovoked firing by Pakistan Army along the LOC in Poonch district. And with that we end the midday news.